Well, welcome back, everyone. There are probably fewer things more important than selecting the right doctor. And we talk about it a lot here because a lot of the people we talk to and a lot of people we interview, it always comes up. So we decided to go to the expert, someone you may recognize, Dr. Dean Limeri, who's the medical director, primary care for Ellis Medicine. So welcome back, Dean.
Thanks for having me.
Nice to have you here. Let's jump into this.
Sure.
Again, it's a very important issue. How to select a doctor? What's the criteria? And you know what? I'm gonna start by asking you a question real fast. The first thing that comes to mind immediately is referral. But there's a lot of falsehoods in referrals.
There is a bit. I mean, referral is my experience, your experience. Did you like the person? Did you connect? And generally, that's what people know. You know, the guy who fixes my car, I don't know how good a mechanic he is. When I come out, the car seems to run. I think he did a great job. But I liked him. And that's what you get most of the time because people don't know what you know.
And of course, again, the chemistry may be a little bit off there. Somebody writes a referral or doesn't write a referral. And a lot of times it's just not based on someone's education or someone's skill set, right?
Exactly.
Yeah, sure.
No, it's based on our bedside manner, if you will. We'll use that term.
Well, perception is, you know, television is a perception medium,
reality.
right?
Yeah.
So perception becomes reality.
That's it.
Boy, is there a falsehood in that. All right, then let's go to the things that you would consider.
Besides, and I don't think we should downplay the referral. I mean, it certainly is important that you have a good connection with your physician, your provider. I think that's key to a lot of things. But what other things should you think about?
Yes.
Other things that are important, I think the big thing that I've written in my book, Medicine is a Team Sport, is the communication. You know, how does the physician or provider communicate things back to you, not just in the office, in the exam room, but afterwards, if you have tests done, you know, do you just get a copy of it in the mail and there's these things you don't understand, or is somebody going to talk to you or send you some kind of explanation?
Got it. All right. And that communication is a two-way street, right?
Absolutely.
So that's doctor to patient, but that's patient to doctor, which is forming the basis of trust.
Right, exactly. And there is that other way, and how you talk to the doctor or how you present things to them, how they want it. And that sort of thing. I've got some patients who will bring in a written summary over the last 6 months of what they do. I happen to like that, but there's a lot of people who look at that and go, oh my God. And so that exchange of information is so important, especially when you're trying to convey something that's wrong with you, to make sure that the provider gets you going down the right path to figure it out.
Now, would that communication also be peer-to-peer, doctor to doctor?
It's so important.
Yeah,
it's so important that if you're seeing specialists, that your primary care doctor is communicating with them, not just the first time they send you, which should be a must, but at other times as well. For example, if you have had a heart attack and you're a diabetic, your cardiologist is interested in how your diabetes is doing. So this regular correspondence will help with that.
Right, well, you figure that people just don't generally have just one thing wrong, that they are connected, right? It's, you know, we've got a complicated machine going on here. I really did take to that point of doctor to doctor, you know. And then Dr. Dean mentioned something about education.
Oh, education is so important. Education is so important. You know, medicine changes much more rapidly. When I was a young doctor, we used to think in 5 years, if you didn't keep yourself up to date, you'd be out of date. Now, it's certainly every 2 years, and some people even will go less than that. I mean, information is coming out so quickly, and things that we think are maybe true-ish today aren't. My first year, and my first day in medical school, I was told 10% of what we teach you is going to be wrong in a year. You need to sort that out and figure out which 10% it is, because we don't know. And there's some truth to that.
Yes, right. And of course, with the technology that we live with today, that's a fast track, right? This stuff must be changing all the time.
It absolutely is. And the other thing, you know, about the communication, besides the fact that you're going to get better care, you're going to get cheaper care. And again, quick example, you know, take your diabetic with heart disease who's probably on a cholesterol drug. Well, if I check your cholesterol today and send this information to your cardiologist, they don't need to do the same thing in 3 months because
Right.
they think, oh, nobody did it, I better do it,
Right.
and spend money that you don't need to spend.
Right, gotcha. Now, again, part of this changing face of medicine, Ellis Medicine has an incredible reputation for being in the community. I mean, you've got offices all through Malta and Schenectady and Clifton Park and all over the place. But you're the medical director. So when you got to hire primary care physicians,
Yes, I
what
do.
do you look for?
I look for to see whether they're going to fit in our mission. And our mission is we want to be serving the community, and we put offices where there seems to be community needs and people are busy. So I don't think we've been
Yes,
too
right.
off on that.
Yes.
But I also ask the providers I interview, whether it's a physician, a nurse practitioner, a physician assistant, is what do you do to keep yourself educated on a regular basis? You know, what are the things that you do? I encourage my doctors and nurse practitioners and PAs, again, all the things we talked about, especially the communication with the specialists, the ongoing communication, and encourage that. These are the things that I look for and encourage and try and foster.
Wow, you do a terrific job. You know, I just want to recap here. We always know referral is important, and you're right. It's not to downplay it. We have friends, we ask questions, and it goes back and forth that way. But the whole idea of going further into the communication between the doctor and the patient and the doctor to specialists, to other doctors, because if it's complicated, other specialists would like to know about it. And of course, that helps you as a primary care physician
does.
complete the picture.
Completes it.
And the one that just always gets to me, continuing education. Boy, is that true.
Yeah.
You know? So, again, you're doing a terrific job. Ellis Medicine has a wonderful reputation for this. Great to see you, and we'll be checking in with you over the winter to find out what else we should be talking about.
I appreciate it.
Right. Great to have you, Dean.
Thank you.
To see this interview again, head to our website, looktvonline.com.